Yeah, that was a study really to my heart. I'm very much interested in factors which can be modifiable by patients or just by every one of us, and which would influence the development of Alzheimer's pathology, specifically amyloid pathology, because this happens very early in this cascade. And we have this population-based prospective study in Rotterdam, the Rotterdam study, where we acquired actigraphy, so the Swiss band watches, where we can monitor activity, so sleep, and when they were active during the day. And then we acquired PET imaging 7 years later, and then we can look how this activity sleep measures would influence the development of amyloid pathology. And what was super interesting for us, that there was indeed an association. So when people had a more fragmented sleep-wake cycle, so they would have shorter stretches of activity, they would go back to resting and activity. So this is a pattern of you woke up during the night or you do a lot of naps during the day, then they had more amyloid pathology. This is of course associational, so no causation can be implied, we all know that, but it's very interesting, I think. So of course we need to see this in the larger picture. There are many studies which looked into same issues, a lot of animal studies where we can more go through the mechanisms. There are very reasonable mechanisms why sleep and the disturbances of the underlying sleep-wake cycle would be related to Alzheimer's disease. For example, the lymphatic system, which clears amyloid, is more efficient, as I think it was twice efficient, they found this in mice, in sleep while in wakefulness in animals. So it makes sense if there's a disturbances, then clearance of amyloid, for example, is impaired. And in humans, I think we are trying more and more, although we also like to treat Alzheimer's, but we really want to go into prevention, because if you don't develop the disease, you also don't need to treat it. And we know it's very difficult to treat. So, and I think sleep management could be, with more evidence, a potential modifiable risk factor, which should go into our prevention strategies, hopefully with more solid evidence.